Good day everyone, I am Romar Gagara and this is my oral presentation for Microbiology Project 1. The article I am assigned to is entitled Aloe Vera Gel, Effective Therapeutic Agent Against Extended Spectrum Beta-lactamase Producing E. coli Isolated from Patients with Urinary Tract Infection in Tehran, Iran. To give a background, the researchers are interested in solving the antibiotic resistance of E. coli by using aloe vera gel to inhibit and to kill the said bacteria. So to give a background, antibiotic resistance is the ability of bacteria to create mechanisms that enable them to survive the harmful effects of antibiotics. The most common approach of pharmacists like me and doctors is to advise the use of beta-lactam drugs. So since we are only allowed very short time, I will explain this to the most simple way I know possible. So, beta-lactam drugs inhibit cell wall synthesis. So there is a biochemical reaction happening when beta-lactam drugs are introduced into the body, and as they enter the cell. So when cell wall synthesis is inhibited, the cell begins to rupture, also known as cell lysis, and then the bacteria is killed in the process. So here are other major mechanisms of beta-lactamase resistance. We have mutations in their PBP. We also have the mutation of porin, which is the entrance of other substances to inform the cell. And then what we are most interested in is about the beta-lactamases, where they degrade the said drug, and which is also the common antibiotic resistance mechanism of bacteria. The study involves 30 males and 30 females with urinary tract infection. There were 245 urine samples collected, 150 of which are E. coli positive. So they only choose them as positive if they entered the 10 to the 5th colony forming units per ml range. They were then isolated at 37 degrees Celsius for 24 to 48 hours. By the way, the distribution is 120 isolates for females and 30 isolates for males. So they have found out that aloe vera has MIC and MBC, or minimum inhibitory concentration, and minimum bactericidal concentration of 50 micrograms per ml and 200 micrograms per ml respectively. In conclusion, aloe vera is effective against Escherichia coli, which are beta-lactamase producing, as the study revealed. However, there was a recommendation to really specifically find what the compound or the molecule is responsible for inhibiting and killing E. coli, because the researchers only used aloe vera gel. So this is a promising study because we are already running out of antibiotics, and bacteria are getting more resistant much faster than the discovery of new drugs. So thank you very much for listening to my report. Goodbye.